You're watching Capital Connection from the Illinois State Capitol.
One of the biggest changes to Illinois' economy was already set in motion well before the first signs of the coronavirus started to show up on our shores, and that was a change in the earning power of people in the working class. The minimum wage being raised over a gradual step increase up to $15 an hour by 2025, and that was a big piece of Governor Pritzker's agenda that he passed into law in his first year in office. The lead of that idea in the Senate joins us now, Senate Majority Leader Kim Lightford. She's working from home today in Maywood. It's good to have you with us, Senator. Thanks for joining us.
Thanks, Mark. Thanks for having me on.
I wonder, there have been, in the wake of all of this economic upheaval, as so many businesses and workers are, businesses are laying workers off, they're furloughing people. We've seen more than 1 million people laid off in all of this. But at the same time, we've also seen society be reminded how many workers in our supply chain or in our grocery stores or in our hospitals are truly essential to our process. So in all of this, there are some politicians who have called for suspending or delaying the onset of this $15 minimum wage, especially downstate in some parts of the state. When you factor all of this and the way our world has truly changed in the last 2 or 3 months, does it change your view or does it reinforce your view of that $15 minimum wage increase? How do you view that issue today?
Well, Mark, it strongly reinforces my whole tenure on what I've been fighting for: fair wages, livable wages for those essential workers. I don't know that we had ever given them a title. I just knew that they were so critical and crucial to our everyday living and everything that we do and the companies that they work for, and that they deserve to have fair wages. For me, it's completely a non-starter. The minimum wage increase will continue as the law has set forth. This July 1st will be another increase. And I don't know that my colleagues really want to withhold funds from those who are really out here during this pandemic, making it happen for all of us. I don't understand the rationale to take income away from them, especially at this crucial and critical time.
So on July 1st, the minimum wage in Illinois will jump from $9.25 an hour up to $10 an hour. And there are some saying downstate or other parts of the state shouldn't have to, the employers shouldn't have to bear that extra payroll in the wake of all this pandemic. But you're prepared to have that political fight in Springfield and to defend this law as it is set in motion already.
Absolutely, I am prepared to do so. There were some other suggestions around regionalization for small businesses who we put a threshold of a tax credit of 50 employees or fewer. And there are some members who are saying perhaps if we increase that threshold to, let's say, 200 employees, that could be helpful to some of those businesses. I'm waiting to see that language, and perhaps that's something, a conversation that could be had. But as far as the wage actually taking shape, it's really a non-starter.
And how much of that thinking, perhaps expanding or considering expanding tax credits to those employers, is because of the pandemic? Because we know that this special session has sort of a limited scope. There's still a lot of things you can cover, but one of them is how to find relief for workers and for businesses in Illinois that have seen their customer base vanish, essentially. The economy in many ways grinding to a halt or stopping immediately. So is the pandemic itself opening pathways or avenues to new ideas when it comes to tax credits or other incentives?
You know, I don't know, Mark, if they're new ideas. I just think some of those old ideas that didn't happen are beginning to just brew up all over again. But timing for me is just not good. And for so many essential workers who are out here every single day risking their lives to make sure that you and I and those members who are wanting to stop their resources from happening actually have a livelihood that continues on. Our job is to keep state government moving forward, not to take money out the mouths of people who are really on the front line making things happen. If you're not a doctor, if you're not a nurse, you're still essential to everyday living. Those who are in the hospitals that are cleaning up behind the doctors and nurses, who are in the kitchens doing the cooking, the maintenance, the cashiers. I mean, you name it. If you go out to the grocery store, you need to go to the bank, or you see who the people are. If you have to take public transportation, you know who they are. And so it's really important that we protect those. And when I think of it, I think of those home health care workers and those nursing home CNAs who are, are dying as well because they're trying to work. They're fighting for hazard pay. And so I just think if we give people a livable wage, perhaps they'd be more prone to continue with what they're doing and feel good about what they're doing, and stay on the front line for all of us. So I just think the timing is poor to take income away from those.
What do you see from your corner of the state? A lot of the lawmakers we've heard from, including recently this week, from 7 downstate Democrats who've called on Governor Pritzker to expedite his plan to reopen slowly parts of the economy and start to bring industries back online. Many people downstate, many lawmakers downstate look around, they just don't see a lot of their neighbors with these symptoms. Their hospitals are still empty. They didn't ever see that big pandemic surge that they prepared for. It's a different picture in Chicago. What are you seeing from that perspective, and what is life like? How might it be different where there is there has been a bigger outbreak of the pandemic there?
It's a huge outbreak. I was just thinking earlier on how I haven't slept all night. I live within blocks from the Hines VA Hospital and Loyola Hospital, and I hear ambulance it's like every 20 minutes there's ambulance, and I just keep thinking that's another life. And our numbers here are just so alarming. And I think that's because we are more tight-knit urban areas where we're pretty much on top of one another. So I get the difference in members downstate who have more land, more space to spread out. I'm grateful that the pandemic hasn't affected them as much as it has us. I can't imagine if the whole state was in the same position. But we're losing lives daily. That number, almost 200 lives in one day, is pretty, it's almost like I can't believe we're living through these times, Mark. And so I just would hope that some people will have more compassion about what's really happening. It reminds me so much of all these gun debates and all these other political debates around things that shouldn't matter. Right now, I see an invisible killer that has no color barriers in terms of blue and red, but it does have barriers on African American communities and Latino communities, and those who have pre-conditioned health challenges, for those who are essential workers, and for those who live in multi-generational homes. And so the impact is significantly greater.
I want to ask you about that because we've heard now in several press conferences from Dr. Ngozi Ezike, the state's Department of Public Health Director, together with Governor Pritzker and some other community leaders, that in fact coronavirus in the death toll has shown up in greater numbers in Hispanic and African American communities. Some have suggested that's because the access to medical care itself over the span of a person's lifetime isn't as equitable for minority communities, and that has led to a bunch of other underlying conditions, and that coronavirus takes advantage of that. Others have suggested that people in minority communities are more prone to have jobs where it's harder to isolate yourself, it's harder to work from home, it's harder to remove yourself from the threat of transmitting that disease. What do you see when you see those death numbers hitting the minority communities especially hard? What lessons or what takeaways do you think there are for us as a state, and why do you think that's happening?
I'd hope as a state that we can take a fair look in resources and addressing needs. It's something that we've been identifying for decades, and I have, that there's institutional racism, there's inequities, there's disparities that impact our livelihood and how we live. And right now we're having this argument over should we stay home to save our lives, or should we open up because some wealthy business people are, their livelihood is in a different direction because they may have to file bankruptcy now, or they're having some economic challenge. Well, we live economic challenges. We live health challenges. We live in work conditions that aren't fair. We're underpaid, and this is generational. It's not something new, but what I witness right now, Mark, is it's all come to the forefront at one time. So you see all of disparities at one time. And I would also say that our younger generation has this huge mistrust in government, that they're not taking it as serious as they ought to, and they're not wearing the proper PPE that they should, and they have grandparents in their home, and they have elderly family members that they're infecting and causing them to lose their lives. So we're in this vicious cycle right now in terms of this pandemic, and I don't foresee an end until a vaccine arrives on the scene. Now, I do want to say on behalf of the governor and his team, I find them to be doing a really good job with given the resources and given the crisis that we're in. No one knows anything day to day. So we're just trying to figure this out and keep state government turning day to day, keep the legislative process moving. But I think that in looking at the state, perhaps there is changes that could be made, and the more news gets better, the less cases, the less deaths. Of course, the governor is going to reconsider his phases, I'm sure. But he had to be responsible enough to put something out there so we can kind of have an idea and be gauged on where we are. So I support what the governor is doing, and I'd hope that the entire state could take a look at this and realize that there is really no one size fit all. We're on different parts of the state, and when all of us legislators come together in this one building, you're going to have legislators who are sitting in the midst of this with legislators who haven't had any contact with anyone at all.
Yeah, that's an interesting thing, and I think lawmakers have to all take a test for coronavirus before they come to Springfield. Have you been tested yet?
I have been tested, but it was earlier on in the pandemic. I will get tested again prior to my arrival. We were encouraged to be tested 5 days before we arrived, so that's something I'm going to do tomorrow.
And there are some lawmakers who have already suggested the instructions say when you're in session, you got to have a mask on. Some lawmakers have, downstate Republicans in Central and Southern Illinois have said maybe they won't wear a mask. Should they?
Absolutely, they should wear a mask. If they don't want to protect themselves, be kind enough to protect the people around you.
Should they be allowed into session or in that same room if they don't?
No, they should not. No, they should not. And the whole thing about my First Amendment and all these things, no one's trying to take any of that away from you. We have a worldly pandemic. You know, it's not that we're just debating a small issue here. We're talking on a national level, over 90,000 deaths. You know, this isn't a small feat here, you know, and then in our state alone, where we over 3,000 deaths. And although it may not be you or your neighbor, it's still your neighbors because we're all in one Illinois. And so we have to be mindful of that. This is not a party line issue. It really isn't. This is for the sake of all of our lives. I would hate if I came there and spread it to a member who is downstate, who had no impact of COVID, and then they return home infected and share that with their whole family. I mean, we have to be mindful in that way as well.
Yeah, it will be interesting. I know a lot of lawmakers are being asked to stay alone in a hotel room as opposed to bunking with someone if they used to share accommodations. Do you expect to be in for the long haul through May 31st? Do you have hope that maybe the legislature might convene and be done with its work before that deadline?
Well, our goal is to have 3 days in Springfield next week, Wednesday, Thursday, and Friday. It takes 3 days to read a budget. In addition to our budget challenges and addressing the deficit, we currently had a deficit, but it's piled on so much greater with the COVID-19. But we're going to address our budget. We're going to have a COVID release package. We're waiting to see what the federal government support can look like so we can figure out what support will be able to bring in revenue. We have a hospital assessment that has a due date for the federal government that we have to meet so that all of our hospitals and critical cares and safety net hospitals can continue to function as they have been. We really need them now more than anything. And we've got a capital reappropriation. We want to make sure capital is happening, people are working so we can get that whole piece going again. So there are constitutional amendments because we have some on the ballot for November. I mean, there's enough issues, Mark, and we had subgroups that have met for the last 6-7 weeks, twice a week. And we've addressed all of the legislative initiatives that were put forth before our committees prior to us leaving early March, and then the additions along the way. So we've been working, and our goal is to get there, address these issues those 3 days, and be able to leave the Capitol. We have been asked to drive along, we have been asked to live along, and while we're in the Capitol building, the Senate that is in the Capitol building, the House members in the Convention Center, of course, a much larger group, we'll be having our small committees, instead of in the committee room, we'll be on the Senate floor so that we can acknowledge social distancing, so that we can have small groups. And then we're trying to work out how we can vote in groups and when all 59 of us are needed to vote on issues. So we're still working things out. We know that our food will be delivered to our office. We're not going to be able to have buffet or dine together. So it's pretty much to the Capitol, stay in your office until you're called upon to arrive on the Senate floor. So
you guys are you're making it harder for lobbyists to lean on you. How are they going to wine and dine the elected officials, the lobbyists, if they can't eat out in the bars and restaurants?
Well, I'm hoping that lobbyists understand the pandemic as well, and they know that this isn't a good time for them to come around because it's very difficult to have that connection. They need to stick to Zooms and webinars and phone calls instead of in person. So we're going to be very limited. We'll have limited staff on site, and so it'll just be a challenge, but we're essential workers, and I feel like if the bus driver can be there, if the cashier can be there, if the nursing home CNA can be there, most certainly we can be at the state capitol to finish up with state government business.
All right, well, we look forward to covering that from a safe social distance. I think they're limiting to just one pool reporter in the building, and then we're going to have to find our own ways to cover all this debate as it unfolds. So an interesting time on the horizon. Senate Majority Leader Kim Lightford joining us. Thanks for logging on.
Thanks for having me, Mark, and you know how to reach me if you need me.
All right. Be well. You too. We're back in just a moment.